with the whole topic of pain, I could talk forever. I have a lot to say, but I'm going to try to keep it about how chiropractic is a potential solution, or at least can be very, very helpful. And I go on tangents a lot, so I'm going to let you guys know now. If I do that, somebody can throw something at me to just steer me back. You can do it. I know you'll do it. No problem. Steer me back on course.
Good at it. Get good in.
Yeah. So I'll bore you a little bit with some of the stats first. We've all heard some of the stats. They're getting worse, of course, every single year. Even though we're putting more money into programs and everything else, even government, Donald Trump has put a ton of money. I think it was $3 billion. And there might be a little bit of light at the end of the tunnel, but so far it's not looking great. So anyway, some of the stats. We have addiction numbers increased by 500% over the last 7 years. 7% of heroin addiction originates from prescribed painkiller abuse. It's actually 80 now. Opioids are a class of drugs that include heroin, synthetics, pain relievers. Of course, this is a big thing. Big money. Anybody ever hear of the Sacco family? Purdue Pharma? So there's multiple lawsuits now against the company. They've made multiple billions of dollars they've made just by with OxyContin, and they're being sued left, right, and center. They actually might have to file bankruptcy. They're being sued so bad. Yeah, so 78 billion annually is the economic burden. What do we got here? So opioid epidemic by the numbers. This is 2016, so 116 people die every day. More now. 11 people misuse prescription opioids. 42,000 people died from overdosing on opioids alone. 2.1 million had an opioid disorder. Like, these stats are crazy. So almost 1 million people use heroin. 2016. 170,000 people use heroin for the first time. 2.1 million people misuse prescription opioids for the first time. 17,000 deaths attributed to overdosing on commonly prescribed opioids. OxyContin being probably the most popular, hydrocodone, Vicodin. 19,000 deaths attributed to overdosing on synthetic. 15,000 deaths attributed to overdosing on heroin. 504 billion in economic costs. Here we have 78 billion. This one says 504. So you will, depending on what you see, what you read, the stats might be, a little different. But this is how scary it is. I mean, it's getting to be so bad that there's like drug dealer MD. Most have probably seen articles about medical doctors that are being indicted. They're being thrown in jail. One guy's, I think he was thrown in jail for like 19 years for supplying drug dealers with opioids. Yeah, I know. So we're just writing books on this stuff now. I mean, the whole healthcare system is insane. New Jersey doctor charged an opioid overdose death of patient. They're going to jail. She was prescribing 130 opioid prescriptions per day, assuming she works 7 days a week. And that was 2002 to 2010. And once the feds caught her, she hopped on a plane and flew to the Bahamas. I don't know where she is now, but 130 prescriptions a day. Like, it doesn't make sense. And I think obviously there's huge money, so that's the motivation for doing something like that. But you have to understand too that like people get into healthcare, or I'm not going to say people, about 80% of people get into healthcare to help people. There's 20% that's not really their motivation. Their motivation is status. Their motivation is money, which is okay if you do it ethically. It's not okay if you don't do it ethically. But when people get into medicine thinking like, oh yeah, I'm going to have this status, I'm going to make so much money, and then you find out what's happening to healthcare, and the day of the rich doctor is over. It's done. I don't know if people know that, but it is done. Unless you own big groups and you're CEO of some large group and you're like, you're doing a lot of other things other than just treating patients, you are an average person. You are maybe upper middle class at best. The average medical doctor makes about, does anybody know? Take a guess.
140.
Way lower.
Really?
Much lower.
80,000 a year.
102. The average chiropractor makes about 78. That's average. So I mean, I know electricians that make more. I know plumbers that make more, right? And so I think this is where it comes from. They kind of get into it, and before they know it, they're probably doing a lot more than they ever thought they'd be doing. 2 Florida doctor. I mean, it goes on and on. You could find, if you Google this, like opioid doctor going to jail or whatever on Google, you will find endless lists of this stuff. So more stats. What's important here? This is actually a scary stat. So we're 5% of the world's population. We consume 99% of the world's hydrocodone. Like, problem, hashtag problem, right? 80% of all opioids in the United States. But I think it's, number one, it's a cultural thing, right? It's like the first thing you think of, and this has everything to do with branding, the way pharmaceutical companies have done this. You can't go to a movie now and not see a commercial about some kind of drug, right? You can't turn on the TV and not see a commercial, especially during the daytime. They target people, they know who's watching their stuff, they know how to make them buy, and they're brilliant at it. So 5% of the world's population, we actually consume over 70% of the world's drugs total. This is just pain medication, opioid medication. So we need a cultural change, we need a paradigm shift in how we view our health and how we approach our bodies, our symptoms, whenever something's going on. Because the first thing people think of, it's like, I have a symptom, what pill do I take, right? Automatically, because you're trained from birth. Two types of opioids. You have mainly the illegal types and the legal types. They have the same effect on the brain, but there's heroin, oxy, hydro, fentanyl, morphine, codeine, more cost. So you have Purdue Pharma and the Sackler family. If you guys want something interesting to watch, YouTube, the Sackler family, lots of stuff, and kind of disgusting, but entertaining. So what are opioids? Opioids are chemicals that attach to opioid receptors in the brain and make you feel great. And that's why people take them, because they love the feeling of them. The problem is that the receptors get used to being stimulated, and then you constantly need more, so you create a tolerance and a dependence on this. Right, so primarily used for pain, obviously, and anesthesia. Originally with opioids, you know how long we were supposed to take opioids? The recommended amount of time?
3 days.
3 days, you got it, yeah. Is it on that one?
No.
Yeah, 3 days was recommended. And now, people are on it for months at a time, if not years, before something bad happens. Yeah, definitely following surgery, and I will also say and mention, but I'm not anti-drug, I'm not anti-medicine, I'm not even anti-opioids. There can be a place for it, especially if somebody has, stage 4 cancer and they're in their final days. Post-surgical, potentially, but we have to really monitor it. We cannot just give in to patient demands, right? It's like, well, ask your doctor about this drug. It's like, no, don't ask your doctor about that drug. The doctor will give you what the doctor thinks you need, right? Well, if you don't give it to me, I'm going to go to the guy down the street. And that's basically what doctors, that's why they do it most of the time. So some of the side effects, we all know most of this stuff: depression, confusion, sleepiness, nausea, constipation, sensitivity to pain. When I say sensitivity to pain, do you guys know what that means? So meaning, like, everybody take your nail and don't scratch too hard, but scratch gently on your hand. Do it. Does it hurt? Not yet, right? How long do you think it's going to take for it to hurt?
Different for everybody.
Different for everybody. A minute, 10 minutes, an hour, right? So eventually the nerves start screaming. And the way to think of this is like if, with the baby, this is a good example. So if I put my baby down and I walk away 10 feet, the baby kind of like, where are you going? And I walk away another 10 feet. Eventually the baby starts to worry. And the further you go, the more the baby starts to worry and scream. So that's sensitivity. That's kind of what happens with pain. Risk factors: multiple prescriptions, taking high doses of opioids, obviously, mental illness, using alcohol and other substances, and then living in rural areas. Some of the history of opioids, so definitely with Purdue and the Sackler family, like I was saying, multiple lawsuits. I hope they go out of business, but the sad thing with that is they'll probably just shut the business down and reopen another one, right?
They also make the cure, right?
They do, yeah, they make Narcan. Yeah. So that was the other thing. So they're the ones who were telling doctors to prescribe the drugs, and if they got addicted, well, here, give them that too then. Generates billions, we talked about that a little bit. Mining, has anybody ever heard this term, mining? So mining is when pharmaceutical companies actually study patterns, prescription patterns for medical doctors, and they target them until they start saying yes. It's like, hey, do you know what this drug? You want to give it to your patients? I'll think about it. You given any drugs to the patient yet? Not really. Any drugs yet? I don't know, I need more information. Constant. It's called mining, and they do it deliberately until they say yes. And they will not stop. They're absolutely relentless. They're the best marketing people on the planet by far. But, you know, it's criminal. And it shouldn't be allowed, but it is. They were giving this stuff away for free. They were saying that there was a 1% chance of addiction. All lies, of course, right? And here's the one really good thing. So the study showed opioids can benefit chronic low back pain on a short-term basis only. Long-term does nothing at all because of the, dependence, essentially. So when prescriptions become a problem, I think they might always be a problem. We're going to get into the paradigm shift in a little bit, but yeah, so 191 million opioid prescriptions in 2017. I think that's a lot, personally. Healthcare providers, the highest prescribing rate in Alabama. The one thing is, when you look at health status in every different state, most people would think that, like, well, maybe they're prescribing more opioids here because they're in more pain. No, that's not true. But they will target people with those risk factors. That's why, like pharmaceutical companies literally will go to medical doctors in those areas where people are on multiple prescriptions, already have a history of alcohol abuse, already have a history of, maybe going to the MD more than the average person, and that's where they focus. West Virginia is really bad, Alabama is really bad, Illinois is kind of right in the middle. We'll show that in a little bit. So these are so National Safety Council experts conducted extensive review of current literature. But anyway, these are some of the action steps that they are recommending every medical clinic take. And they're pretty simple things. So making sure the doctors are educated on how to prescribe the drugs. Right? Good idea. Implementing opioid prescription guidelines. Good idea. How do you know how to prescribe if you don't have guidelines? Integrating prescription drug monitoring programs in a clinical setting so you know that person didn't go down the street to get more. Improving data collection, of course, same thing, monitoring patients. Treating opioid overdose. Increasing availability of opioid use disorder treatment. So pretty standard stuff, and here is a map of what's going on in the country. So the only ones that are doing well are in green. Red's failing completely, so they only meet one of those indicators. Illinois is right here, so we're only meeting 3 out of 6. And again, right, it's like, I don't know how that's that difficult, but it is, apparently. Okay, so there we are. For those that aren't good in geography, I'm Canadian, by the way, and I know all those states. Okay, so more evidence that the opioid epidemic is only getting worse, like we said. So 71,568 predicted drug overdose deaths were reported in a 12-month period. Predicted number of deaths from drug overdose was 32% in Nebraska, 24% in New Jersey. They're saying because at first they were taking some of the least amount in the country. The rise in fatal drug overdose is almost entirely responsible for the growth in mortality rates for mainly white males. Okay. Medicaid patients, I won't spend too much time going over this. Medicaid patients have definitely been prescribed more. I don't really know why, and I don't know if it just has something to do with Medicaid as an insurance company is awful. They don't pay anything for chiropractic, and I know they barely pay anything for medical providers. So I don't know if that has something to do with it. I don't know if it's like, you're here you go, get out of my office, I need to see other patients. But 40% more. Okay, some more stats. Stats get boring after a while, don't they? It's like, they're bad. You want to get into the good stuff? 1 in 4 patients receive long-term opioid therapy in a primary care setting struggles with opioid addiction. Okay, 1 in 4 will struggle with opioid addiction. And it's not, there's no bias to this. It doesn't matter if you're a CEO of a Fortune 500 company or like a junkie on the street. Anybody can get addicted to this stuff, of course, right? Okay, so average cost, $92,000. This is what it leads to, of course. Another opioid, illegal. Look, this I thought was hilarious. Can't see it. For non-addictive relief from the cough. Try heroin. Okay, so as a chiropractor, this is where we start to get into what I do. Most people that start opioids start because of back pain, and then 80% of people that get into heroin is from back pain. I mean, if anybody knows anything about what a chiropractor does, most will say, yeah, you do back pain, right? Like we do more than that, but that's what most people think. And we have great results with it. Study after study shows it's one of the best things that you can do for back pain, neck pain, headaches, TMJ pain, hip pain, knee pain. And most clinics now are integrated as far as doing more than just the standard rack 'em and crack 'em, get out of the office. Our office does lots of physical therapy, massage therapy, acupuncture, big on weight loss, so lots of different things. And we're even integrating now, currently with a nurse practitioner to do stem cells. So that's gonna be really awesome. We're not quite there yet, but it's gonna be about another month. Yeah, alcohol, marijuana, cocaine, and more opioids lead to increased risk of getting into heroin. Even this, right? I mean, we're in a culture now where we think marijuana is okay because it's natural. Guess what else is natural? Heroin, right? Guess what else is natural? Cocaine. Just because it's natural does not mean it's good for you. But people think that, like, well, maybe I should do that instead of oxys. Okay. It's probably a better alternative than doing OxyContin, but it's still a drug, it's still a substance, and it's going to cause a problem down the road, for sure. And it is a gateway drug. Fentanyl, another opioid, but we can skip this one. This is one of the treatments that we use, Narcan, right? We just talked about that, how Purdue Pharma made the cure for the drug. Okay, so solution, paradigm shift. How would you health? This is the biggest thing that I struggle with my patients, because it's always like, well, what treatment can you give me to help with my knee pain? It's like, stop, that's not how we do this. It's not gonna happen overnight. It's not gonna be, something that's just miraculous. You have to put time into something like this. You have to do it consistently, and if you do, you'll get a change. And if you don't, right, like the American mentality is like, I want it now, I want it free, I want to drive through, I don't want to spend any time or energy doing it, and if I have to come in 3 times a week, I'm just not going to do it. It's like, okay, well, I guess you're not going to do it then. So that's our philosophy, right? That's how we do everything. Is it a prescriber problem? I don't know if it's necessarily I know a lot of really good medical doctors that are very caring and truly want to help people. They do. Do they know everything? No. And they are definitely influenced very easily. So I think it's very important for everybody that sees their doctor to question them. And they don't have to be confrontational about it, but you can ask them questions. If they say, well, I think you need this, like, well, okay, that's cool. Do I have options, doctor? I don't know. Like what? Well, what about this? Maybe. Right? I mean, I always think that conservative is the best thing to try first because there's no side effects. The worst thing that will happen at our office is nothing will happen. It'll never make you worse. So it's always worth a shot. We talked about branding a little bit, but I can tell you that, like, as a chiropractor, I've always been the crazy one because I view health in a completely different way. And that's why I got into chiropractic. I'm not a chiropractor, or I guess I should say I don't have a belief system because I'm a chiropractor, but I went into chiropractic because of my belief system. So this is really interesting. Most people don't know this, but there's something called the Wilk trial. So the American Medical Association in the 70s tried to eliminate chiropractic as a whole, as a profession, 100%. And it was just based on the fact that it was competition for the American Medical Association. They're taking dollars away from them, so they published lies all over the place. And 4 or 5, maybe it was 6 chiropractors sued the AMA. Imagine that. 5 guys, were like, we're going to sue you guys, like David versus Goliath. And they actually won. They beat the AMA in court. They were sued for conspiracy, right? Pure lies, but eliminating the profession based on competition. And all the things that they talked about they've still been perpetuated to this day, right? Like chiropractors are cultists, we're non-scientific, we're not real doctors, we don't know what we're doing, you shouldn't go to a chiropractor, you have to go forever if you see a chiropractor. They'll hurt you, they'll cause a stroke, they might break your neck. Anything else?
Popping your joints is bad.
Sure. Right? Like everybody's heard that stuff. And so we're like, no, that's not true. Well, my medical doctor said that. My uncle said that. Oh, by the way, my uncle cracked my neck in the backyard at the barbecue last week. Is that okay? It's like, no, not okay. So anyways, but now, I've always been very proactive in meeting medical professionals because I do something they don't, and they do something I don't. So it's like, they have a good idea, let's work together. Does that sound a good idea? Like, yeah, that actually does sound a good idea. Cool, let's do that. Let's work together for the good of the patient so they can get better and not have to go through harmful surgeries and different kinds of procedures. Sound good? Yeah, it's great. But so the difference between the two, right? Chiropractic is not an alternative. It's not an alternative because it does something completely different. We're not trying to just alleviate symptoms. We focus on biomechanical issues to get people moving properly, not just take a pill and palliate. But so when we look at dysfunction versus disease, medical doctors are good at handling disease for the most part, and chiropractors for the most part are good at handling dysfunction. So what do I mean by that? If you go to your medical doctor, I'll tell you how we do this differently. Patient comes in, they go, oh, you have high blood pressure. High blood pressure is bad, you know, it can end up causing a heart attack. We got to get your blood pressure down. Okay, that makes sense. So they give pills to bring blood pressure down. The chiropractor does not look at that problem like that at all. The chiropractor looks at the problem and says, what's causing the high blood pressure? Are you stressed? Yeah, okay. You're overweight, you're 50 pounds overweight. That's going to cause some more stress on your vascular system. Potentially there's stress on the nerve tissue going to your heart. Potentially there's stress in the upper part of the neck that controls blood pressure monitoring. So why don't we try that stuff first to get to the root cause of the problem so that you don't have to take the pills. Because even research shows that just lowering blood pressure with pills doesn't increase longevity of life. It looks good on paper, and that's all it does. Heart disease is going up every single year along with cancer. We have more pills. They just say we prescribe over 70% of the world's drugs. And if drugs was the solution to this whole healthcare crisis that we have, we would have the healthiest country in the world with very, very low amounts of disease, and we do not. Right? So dysfunction. High blood pressure is not a disease. High cholesterol is not a disease. Back pain is not a disease, but we kind of treat it like a disease. It's dysfunction. So when you have a symptom, something is causing the symptom. And that's how chiropractors view everything. Make sense? Autonomic nervous system. Okay, so this, anybody hear of fight or flight? What time do we have?
Clock's right over there.
Yeah,
It's not right. It's 6?
Yes, yes.
2:30 in the morning.
Alright. I talk a long time usually, but not that long. So fight or flight. Fight or flight is a system that your body goes in to survive, and it's good to be in that state if you need to survive, right? If you get scared, if somebody's trying to hurt you, you want to be in that state where your blood pressure is heightened. Even cholesterol is heightened during fight or flight. Digestion shuts down, your pupils will dilate, your breathing gets more shallow, and your body does that to help you survive, either fight the bear or run away from the bear. But we live in a country that it's constant fight or flight all the time. Money, family, job, right? Always like beating us down constantly. Nobody wants a hobby because we don't have time for a hobby. We need to make time for hobbies. But we have to do things that push us away from being in this fight or flight state that puts us in a state where we actually repair, grow and repair. But the average person does not do that. So chiropractors constantly try to put people back into a state of growth and repair. We try to get them out of fight or flight, out of the sympathetic state, so their body can actually heal on its own. Neuroplasticity is when your brain starts feeling, when your body is in pain, your brain is basically what sends the signal. So when somebody says it's all in your head, it really is all in your head. But the more you experience pain, the more these pathways grow. So you become sensitized to it. So imagine like if you first start having a little bit of low back pain, maybe it's not really pain, it's more like a stiffness. Nothing, no big deal. Imagine that, it's just like one lane dirt road. And as the pain heightens, it becomes more of like an interstate with a ton of traffic that's screaming, right, all the time. So that's what happens with neuroplasticity. The more you are in pain, and it doesn't have to be pain, I say pain, but it can be pins and needles, numbness, tingling, stiffness, that's pain. But the more you experience that, the more it plasticizes in your nervous system and becomes almost hardwired. You can reverse it, but you're wiring your brain differently. And when you are in pain, you put yourself in a fight or flight state. Pain puts you in a state where you are breaking down, not repairing. So yeah, you can take a pill and cover up pain, but you are still, it doesn't change the state that you're in. Because it's like taking batteries out of a smoke detector. There's a fire somewhere, right? Beep, beep, beep. It's like, shh, I want the house to burn. Don't make any noise, please. And thoughts, traumas, toxins, this is one of the things that we always like to address with all the patients. I mean, the way you think actually affects physiology, right? And you can, I mean, it's really easy. Somebody comes in and they're miserable, like, what's the happiest day in your life? And they go, oh, well, when my daughter was born. It's like all of a sudden they were miserable and they walked in and bang, you got them, right? And they're happy now. But then as soon as they go back to something else, but it's something you have to do constantly. You have to train your brain. You have to use this concept of neuroplasticity to create a new reality in your brain. Trauma, the same thing. The more your body experiences physical trauma, whether it's sports, car accidents, trips, falls, work injuries, you're going to start having issues with pain. And then toxins. Toxins will sensitize you to pain. Air fresheners, soaps, alcohol, drugs, anything that's toxic, that's not good for you, puts you in that state right there, fight or flight. Okay, so what is pain? We all know what pain is. It's just a discomfort. There's two types, chronic and acute. Acute goes away pretty quick. Chronic stays around for a long time. Let me see here. So as a chiropractor, when somebody comes in with pain, the first thing that I look for is biomechanical dysfunction of their spine and their joints. So we want to make sure things are moving properly. If somebody says, oh, I can't turn my head to the right. I can turn it fine to the left. I can't go to the right. It's like, okay, let's look at that. So when we induce motion in the spine with an adjustment, we call it, we're actually essentially stimulating the joints to move. But we're also stimulating the nervous system to respond, basically like control the muscles, and we're telling it that this is normal. This is where we want your neck to go. And so they get adjusted and they go, oh yeah, I can move it better all of a sudden. Right? So I mean, it's simple, just inducing motion into the spine resets the nervous system and allows the spine to move properly, decreasing pain. Not always right away. Sometimes you have to do it, like I said, over a period of time. It has to be done consistently. Let's go to the next one. This is sort of how it works. Yeah, so when a child gets separated from his mother or father, they scream. That's what happens when you have, let me go back. Going back to not being able to turn your head. Everybody knows what a dislocation is, right? If I have two bones and I dislocate them, it's full, like complete separation. A subluxation, which is what chiropractors treat, is partial. It's a partial dislocation, restriction, joint's not moving properly. So I'm going to use that S word now. So a subluxation is a disconnect between your brain and your body. So everybody has this idea that like chiropractors just kind of crack bones, but we are restoring motion and we are retraining your nervous system to be at a new normal. And we crack bones too. But that's what it is. So when you have a subluxation somewhere in your spine, there's a disconnect between your brain and the end organ or the tissue, wherever it's going, and that's what sends a pain signal. Your brain is saying there's a disconnection there, and it sends a pain signal. The longer it's there, the more you become hardwired, the worse it's going to be, and eventually, if you can't, stretch it out, you're going to seek medication. This is really cool. Going back to fight or flight, when you're in that state of stress, when your body's in pain, or whatever else it may be, you first go into a state of alarm, fight or flight, right? The American lifestyle, fight or flight. Then you start to resist, so you try to adapt to the situation that you're in. You can adapt sometimes, and sometimes you can't adapt, and if you can't adapt, you become exhausted. You know the next step after exhaustion? Death. So those are the steps. Alarm, resistance, exhaustion, and death. And it's not just with pain, it's with every condition you can think of. these are some studies now that I'll show you just to prove the, or show you some of the efficacy, I guess, of chiropractic. But Fibromyalgia and Chronic Pain Association promotes integrated healthcare for fibro and recognizes the importance of spinal health. Appropriate chiropractic care as non-pharmacological pain treatment and biopsychosocial model of care is recommended. St. Joe's Regional Medical Center in Paterson, New Jersey became the first hospital in the country to implement a program that manages patients' pain in the emergency room with integrated care, such as chiropractic, and without the use of opioids. I'm not doing it here yet. So this doctor here, he's a medical doctor, but he says it should be treated, pain should be treated as a disease process. Affects the central nervous system as well as emotional components. That's why most people, when they're in chronic pain, they get real edgy, right? They get depressed, they get a lot of anxiety, they can't sleep. It really affects everything. Exploration of pain as a disease process rather than just as inconvenient symptoms, essential for responding appropriately to pain. But it just makes sense, like going back to what I was saying earlier, is how we need a paradigm shift. We need to start viewing our bodies, viewing our health completely differently. And unless we don't, nothing is going to change. But CDC guidelines, National Pain Strategy, now encouraging medical doctors to utilize chiropractic. And I won't tell you, there's a local group here who I used to work with some of the doctors quite closely, and all of a sudden we couldn't work together anymore because they were told from the top that they couldn't send their business to another provider outside the group. Even though I was sending them more than they were sending me. So that's what we're dealing with. And it really had nothing to do with, there was no bad relationship, everything was fine, but higher up said, you can't do that, you can't give the business away, you're not allowed. Okay, then hire a chiropractor, they didn't. So how can chiropractic help? So 75 million Americans suffer with back and neck pain. Apparently 80% of people will have back or neck pain at some point in their life. Number one most plagued musculoskeletal condition in the country is low back pain. Number 2 is TMD. Number 3 is headaches. Three. Low back pain, TMD, and headaches. And chiropractic is good for all of them. TMD, actually, anybody ever have that? Horribly painful. But most dentists, yeah, they call it the black hole of dentistry because it's so bad nobody wants to go near it. Like the dentists themselves, the orthodontist, they don't want to touch it. It's awful. So the main treatment for TMD in the world of dentistry is cutting the condyle off. So then you just have like a loose jaw. Just bite your cheek, bite your tongue for the rest of your life. Okay, so reduces healthcare costs per person. Let's see, Agency for Healthcare Research and Quality, according to research published by AHRQ, spinal manipulative therapy, aka the adjustment, effectively and significantly reduces pain and improves function for patients with non-specific low back pain. 9 out of 10 patients indicate a high level of satisfaction. Ours are 10, right, Ed? 10 out of 10? Solid 10?
Yep.
Maybe a little less, but in another study, North Carolina patients seeking treatment for acute low back pain from various healthcare professionals, PCPs, chiros, orthos, researchers found that those who visited a chiropractor had a higher degree of satisfaction in the care they received. Spine, great journal, randomized controlled trial compared full evidence based clinical practice guideline treatments, including spinal manipulative therapy administered by chiros to family physician directed usual care and treatment of patient in acute mechanical low back pain. I'll transit this after. Compared to family physician directed full CPG based treatment, including chiropractic, spinal manipulative therapy, is associated with significant greater improvement in condition specific functioning. Chiropractic work better than medicine for pain. In the Journal of Spine, huge journal. Journal manipulative, and so I got lots of these. I'm gonna keep saying them until somebody goes, I believe you. Yeah, so it's Duke study. Neck pain, headache, cervical spine manipulation associated with significant improvement in headache outcomes. Now there's spine. Right, I mean, it goes on and on. Blue Cross study. 85,000 beneficiaries over a 2-year span, include low back pain, initiated with a doctor of chiropractic, saves 40% on healthcare costs.
They don't cover it most of the time.
Blue Cross did.
There's a reason that they don't not cover something because it's not effective, just so you know. So I know a few people at Blue Cross, a couple that are pretty high up. The reason why any insurance company that's publicly traded, right? They have to keep their shares up for investors, because if they don't, they sell their shares. We don't want that. But the insurance company gets a percentage of profit, and so they basically try to pay for things that are more profitable, right? Like if somebody pays me $50 and I take 40, it's $15 of profit, right? If somebody does $150,000 surgery, but the cost of that surgery is $30,000, get it? So they get a percentage of profit. So they basically know what they want to pay, and once they hit that number, then they stop paying, and that's why they start saying things like, "Well, orthotics, we think they're experimental now. Orthotics they're not scientific. Those are just experimental. So we're not going to pay for those anymore." And that's just how they do things, right? So I mean, whether they pay or they don't pay, I don't know. That's a whole issue in itself, right? But it does. So it decreases healthcare costs of comparative care integrated through a medical doctor. Another study, yeah, this is cool. So for low back pain, this European Union study, chiropractic care increased total annual per patient spending. You spend $75 extra per year, and you get better results for your low back, or you save $302 per year, and you get better results for your neck pain. So again, just effectiveness. So okay, so this is the end here. So top 8 things to remember: opioids are highly addictive. Right? They shouldn't be used for more than 3 days. They are not intended for chronic pain. They should not be the first line of response when it comes to pain, ever. Opioid addiction knows no bounds, right? Anybody can be addicted to this stuff, doesn't matter who you are. In the time we spent in this discussion, 6 people died in this country of opioid use and abuse. And yeah, so here you can play your part, which we're doing now, right? We're talking about it, we're trying to figure out solutions. This is going to go live. Well, maybe is it live, or we're just recording?
Just recording.
We're just recording. So it's going to go on later, after we edit it and make it look nicer. No, I'm kidding. But yeah, so I mean, just talking about it, of course, and then resources, lots of resources out there. I think I put them here. So these are good. I can send you guys this stuff if you want. I even have things for physicians. So if you ever go to your medical doctor and you ask them, like, would you have guidelines on opioid use? They might say yes, they might say no. You can give them that, and it's actually from the CDC. So they'll take it. So yeah, I had a lot of things to say. I think I did okay with time. And if anybody has any questions, I hope I tried really showing the chiropractic as, you know, a potential solution for handling back pain. And it is, I can't tell you, like, I think most people think that because it's so simple. Somebody just lays on a table, put her hands on them, make some things move. Some people don't think that that's enough. But I can promise you, and those who've been, you know that you can get a huge change pretty quickly. Again, not always, sometimes it takes time, but just because we're not using like fancy equipment, MRI, well, sometimes you have to use MRI and things, but if we're not using fancy equipment to treat the person, people should not think that it's not going to be effective. That unfortunately is the mindset that some people have, but sometimes, you know, keep it simple, stupid goes a long way. Questions, anybody?
I just want to say I think it's really relevant to what actually Sherry and I just were working on when we went to the Coalition Academy. So we're looking at local conditions to why youth prescription drug use is so high in our community. And one of the things that we thought we might identify, and you kind of reaffirmed it here, is that when families or kids go to the doctor, they almost are demanding medicine. Like they think that a pill is going to cure whatever ailment they have. So if they can't concentrate in school, they're demanding Adderall. If they or if they have pain, we're demanding pain management or medicine. So I think it's really interesting to hear from a different source that these are kind of things that we're seeing more and more in our community. And I think that changing the norms can definitely play a big role into changing, you know, our prescription and our drug use, especially with heroin and things like that.
Yeah,
as
and
well.
that's tough, like
Mhm.
changing the norms,
Oh,
because
yeah.
they're heavy hitters, right? Like they spend billions of dollars on marketing,
Mhm.
and like the more you're exposed to something, the more it's gonna become your normal belief system.
Yeah.
Right? If somebody, regardless of what it is, if you hear something over and over and over again, you're gonna be numb to it. It's gonna be like your new reality.
Mhm.
So you have to. I mean, I don't think it's normal to take medication unless you absolutely need it. And then people say, well, yeah, I think I do. I absolutely need it. It's like, right? It's like you have to. What's the threshold when somebody actually needs it?
Right. How did our great grandparents get by?
Exactly. Right? Wild animals. How do they do it? They're not getting pumped full with like 70 vaccines and taking like 9 prescription medications and everything else. Like, so I mean, every single pill, every single potion, lotion out there is marketed, and the effectiveness is not what they say it is. I don't care what anybody says, it's not, and we have the stats to prove it. But people just have to be smart with their bodies. You have to know that there are alternatives to treating your conditions other than just taking pills. All right, like what's a treatment for high blood pressure?
Exercise.
Yeah.
Lose weight.
Lose weight, walk in the grass, and do deep breathing, yoga, right? There's all these different solutions out there, but people don't want to put the work in to do them because it's really
It's
easy,
work, yeah.
right? Take a pill, swallow it, and you're good. So we think.
How often do you run into the case where you have somebody that's coming to you, you're really helping them, and all of a sudden they stop coming because of insurance not helping?
Well, it doesn't happen a lot, but it happens. Yeah, but you know, we do, when it comes to something like that, like we have cash discounts, so people do get discounts if their insurance doesn't cover something, and then we finance it for them. So we even have like financing companies like Care Credit, they can pay it off over 2 years, it's 0% interest, they still get the care that they need. But we can only do so much when it comes to something like that. Like if somebody doesn't want to actually make the investment in their health to get better, I mean, if they think it's, you know, like we see people sometimes that come in with like new cars, new purses, new phones, and everything else, but they don't have money to pay for their care plan. It's like, I can't convince you that your body is more important, so I don't know what else to tell you, right? So it comes down to priority, like what, for me, my priority is my health and my body. Like this is more important for me than anything else. Like when people say it's expensive to pay like $75 a month to go to the gym, I think I'm stealing from the gym. Because I know the value I'm getting by going to the gym. Not that you have to go to a gym, but just exercising in general. Like you can't put a cost on that. But you know, people are fine spending $100 on a bottle of tequila and going to whatever restaurant and spending $150, like it's no big deal, right? Buying a purse that's $300, no big deal. So it's just priorities. It's the American mindset. Like we want to be showy, we want to have stuff. More stuff the better, right? God forbid minimalism, whatever. You gotta have a new car every 3 years, otherwise you can't keep up with your neighbor. So I do have a different view on that whole, you know, social aspect because I'm from a different country, even though it's right next door. Canadians don't do the same things that Americans do at all. Some things maybe, but it's a different lifestyle. So I make fun of my wife all the time because she's not Canadian, but you know.
What really struck me was, you hit the word paradigm shift, like, there are so many parallels in what you were talking about with us and what prevention work is trying to do with the coalition and even recovery. Like, it's not about treating the symptoms, it's about treating the root causes. With anything with addiction, anything with prevention of addiction, or even with recovering addicts, you don't just say, you know, hey, here's something to mask what's going on. You dig deep to find out you address the underlying issues, and there needs to be a paradigm shift there too. I mean, I wrote down like 15 things that completely parallel what you were saying with the work that everybody here does with recovery and with prevention.
Yeah, I mean,
There's
prevention
a lot
is a huge part of it,
Yeah,
for
that
sure.
was really cool.
If you go to like India, right, with Ayurvedic medicine, if somebody says, hey doc, I'm depressed, they go, that's okay, you're depressed, take your shoes off, take your socks off, go walk on the grass for 20 minutes. That's their treatment. Like, and it didn't help, okay, listen to some music. You'll feel better.
Thank you for coming.
Yes.
It was really good.
Thanks for having me. Cool.
Thanks for posting cool stuff on.
Oh, yeah, I read all that.